The U.S. older adult population, 60 years old and up, is projected to increase by 42% between 2010 and 2050. Older adults tend to be at an increased risk for undernourishment due to a variety of factors, including physical, social, cognitive, and socioeconomic changes, as well as diseases and impairments. In some circumstances, individuals are receiving adequate intake but have alterations in nutrient needs or metabolism, often due to drug-nutrient interactions. Poor nutritional status negatively affects organ systems in the body, leading to reduced bone mass, compromised immune function, and increased morbidity. These factors can result in loss of independence or institutionalization, and when individuals cannot grocery shop or cook for themselves, the risk for nutritional deficiencies is even greater. This prompts the necessity for services that can help address nutrient needs of older adults. Home delivery meals were established in 1978 under the Older Americans Act to address hunger, food insecurity, and prevent nutritional deficiencies in older adults. Requests for home delivery meals increased 79% from 2007 to 2010, with 22% of the surveyed programs reporting they were unable to meet the volume of requests. Funding increased by 65% from 1990 to 2010, but the funding was unable to keep up with the demand. Research showing nutrition-related outcomes and benefits is the key to expanding these programs. Benefits of home-delivered meals include balanced nutrition. Meal delivery services for seniors differ from other meal delivery services because they need to be balanced with the right proportions, lower in sodium, and can be catered to specific diets. This is important to note as there is an increased prevalence of diabetes and heart disease. They can ease stress on caregivers and make staying home easier and more comfortable. They take away the need for grocery shopping and cooking. These can add a lot of stress to older adults' lives as they have to rely on someone to drive them to the store or take public transportation. There is the added hassle of creating a grocery list, pushing the cart, making it back home, and putting everything away. This is especially challenging for those with mobility issues or physical impairments. Having meal choices can encourage independence and meal consumption. They are also convenient as most meals can be thrown in the oven or microwave. There are reductions in hospital admission and readmission. Many studies show that better nutrition decreases hospitalizations or the length of time spent in the hospital for older adults. They can be budget-friendly for those who can pay out of pocket or through government-sponsored programs. Many studies have shown that those who start out as undernourished at baseline become well-nourished after receiving the home delivery meal services for a length of time. Home delivery meals can ease loneliness and psychological stress. For some individuals, they do not have the opportunity for personal connections on a daily basis. They may talk on the phone with friends or family, but they are not able to physically see someone very often. The volunteer delivering the meals may be the only person they see. Along with this, having a meal delivery service allows the volunteer to keep an eye on the recipient and follow up if they are unable to contact them. Some ways these services can be improved upon is by having additional food products provided, such as smoothies or high-calorie or high-protein snacks. Adding educational programs that can encourage routine check-ins with doctors and referrals to other programs, as malnourishment is not just related to food intake, but to disease, social, cognitive, and physical changes or limitations. And offering additional meals should be a consideration, as one meal a day may not be sufficient for some individuals to meet their micro and macronutrient needs. It is important for research on these programs to continue, so data from the studies can be used to improve and expand upon these home delivery services.